Here we are with Tom. Tom came to me because he suffered from lower back pain, but only when he plays sport and when he runs. Today I will ask him to perform some range of motion test, so you need to see the restriction that he has now. I will show you what I will do when he lies on his back, and then I will do a treatment and I will show you if there is any change at the end of the session. Can you just try to touch your toes? Okay, so the spine bend enough, is quite, this part doesn't bend a lot, but more or less the mobility is not too bad. Okay, now sideways, this one, okay, and the other one, which one is better?
This one is easier.
You feel easier?
Neither's easy.
Yeah?
No.
Okay, but there is a difference, yeah?
Yeah.
Definitely there is a difference. Okay, now please lie on your back. Lie on your back. I already asked the injury he got in his life, and the main injury, this is a massive injury, is a fracture of the skull. Yeah, the fracture of the skull just above one of the eyes. So with this position, I obviously will feel some, it's very clear there are some torsional movement. If I check the neck is completely fine. This is the trick with the skull. You have a problem on the skull, here it can be completely fine. So the neck moves completely fine, left and right. The shoulder, completely fine. And now we check, obviously, the lumbar spine. Let's see the lumbar spine. So I grab the spine and try to move it on the right, on the left. It doesn't move. It's more stiff right to left, but even the other side is very, very, very stiff. If I try to lift the pelvis, it cannot be lifted on both sides. This side is very heavy, this side is heavy as well. Now it doesn't know how it should be, so to let him be more aware of how a pelvis should move, I need to treat him. Regarding the leg, he has a restriction mainly on the internal rotation, but also the external rotation of the hip is not very great, but the internal rotation is a little bit worse. He has this behavior with the leg a little bit externally rotated, because if we put the leg like that, the knee is not able to extend at all. If I pull one leg and the other one down, this one goes down a little bit more than the other one. What should I do here? I already know he had a fracture on the skull, so when I ask the patient the past medical history and they report a fracture on the skull, I already have what I need. So definitely this is a patient which needs a treatment, a local treatment. This is the trick with the skull. If you have a fracture on the pelvis, you will feel the pelvis completely blocked. But if you have a fracture on the skull, obviously you cannot test the skull itself, but if you check the neck and the shoulder, they can be completely fine. Full range of motion, the patient doesn't feel anything on the top. But definitely, if I put my hand like that, the fracture is around this area, just above the orbit. What do I feel? From this position, the hand on top moves toward the hand on the bottom and vice versa. So there is a kind of compression around there. You need to know the skull is formed, so the bone of the skull are formed inside 2 layers of meninges. So if you heard about meninges from meningitis, from inflammation of the meninges, a lot of people think the meninges are inside only. But from the embryology, if you check a book of embryology, the bone basically arise inside the meninges as well as the vessel. So basically, because there are lots of, is basically filled of meninges, and then this meninges goes inside the spinal cord. Let's say not inside, outside the spinal cord. A fracture here can affect, possibly through the meninges, all the spine. And there is also, as I said before, a very, very big connection in between the skull and the pelvis. So this part of the skull more or less will affect a lot an area of the pelvis which it can be around S2, S3. Can you lift a little bit? Okay, leave it down, just return back. If I push the coccyx, is okay, moves, and this part is like if I'm touching a rock. The top of the sacrum is okay. The middle part of the sacrum is like really touching a wall. Okay, it doesn't move at all. Okay, probably I won't show the treatment because there is nothing to see. It's long. The camera doesn't allow me to go over 30 minutes, but definitely I will show if there is any change at the end. No. Take a deep breath. Okay. Can you move a bit over the left?
Yes.
And a little bit below. Yeah.
Okay.
Yeah. Good. So what do I need to achieve? Obviously I need to achieve a change in the pelvis. The pelvis has to move because the spine is completely, the lumbar spine is completely blocked, both sides. It's stiff, very, very, very stiff. Usually it moves a lot more on one side than the other. In this case, both sides are quite stiff. This is why it doesn't have a permanent lower back pain. If there was a difference in between the left and the right side bending of the spine, it would be in pain constantly, more frequently. So in this case, his spine is very, 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 let's use the word stuck. And so only when he overdo during sport activity, he can feel something. Probably it's not even a big pain for him. Deep breath. Okay. Deep breath. Do you recall any fall on the pelvis?
Significant.
Any?
Yeah, like
Many,
I played a lot of rugby.
Ah, okay. Oh, perfect. Good. Just relax completely. So it looks like there is something here. Lift a little bit. Mm-hmm. Maybe you don't feel, but the position of your leg is a little bit different than before.
Okay.
But well, you were completely sleeping.
Yeah, right.
You didn't feel any bad. Anyway. So any other problem on ribs, or let me check the rib. I check on the front because it's a male, yeah, otherwise they can be checked from the back. Ooh, okay. You feel here?
Yeah.
It's different than this one, eh?
Okay.
Let me check it because it can be something else as well. Because the skull looks like it works a little bit better, but there is this shoulder, there is a little bit like that. Take a deep breath and out. Okay. You feel how hard it
Yeah,
is?
yeah.
Deep breath. Out.
This?
Yeah, just relax. Take a deep breath. Just check if still recording. I close and open again. Was close to the 30 minutes, so I just close and open again. I just check everything. Lift a little bit your pelvis. Okay? Lift here? Okay. Did you have any car accident?
Yes.
No. So the car accident usually compress all the spine, so the pelvis and the skull. If I ask him to have a deep breath, my hand will move toward each other, so like if the spine is compressing a little bit. This is the real whiplash. Please take a deep breath. Deep breath. Okay. Just relax completely the spine. Any other injury?
No.
Just relax, relax. Lift a little bit. Deep breath. Okay. Deep breath. Relax. You feel this, yeah? It's hard. This part is connected with this part here, the rib, which it will stand if it's here or if it's there. Lift a little bit, okay? Ooh. It's painful, yeah?
That is, yeah.
This one. Deep breath. Again. Okay. So I don't know if it's noticeable, but when you breathe, the rib cage basically moves like that. Instead of going up like this, it does just this movement. Do it again. Okay. Okay, there is something here as well. deep breath. Again. Again. Another one. Oh, you feel?
Yeah.
It moves a lot better, eh?
Yeah.
So there was also so rugby gives a lot of injury, to be honest. Did you fracture the skull during rugby? No, it was another injury. But definitely these things here is very frequent on rugby play. Now, okay, now I can say it's very light.
Yeah.
But definitely there are other injury because at this age you accumulate a lot of injury. Fall, he had a fracture on the skull, immense injury. There was something here, it was affecting the breathing. If you return back on the video, before the rib cage was moving a little bit more like that, now is a little bit, expand, it inhale a little bit more toward the top. There is a very, very big connection. I explained this in a previous video, in between the upper lumbar spine and the lower neck. So the problem was lower neck and rib, the first rib. Take a deep breath. Out. Okay. So the restriction on the upper lumbar spine on the left was connected with an injury around this area here, neck and the rib. Treated there, this part improved a lot. So I already can expect an improvement. This part is definitely a lot lighter than before. Okay. The other part is different, so it's not as light as the other one, but because there are other injury. Now I forced a little bit. The session is a little bit too long, so I try to treat many things. Usually a session is 1-2 dysfunction, so the skull was already enough, skull and cartilage was already enough. Then that one probably was needed, so they were quite equally important. Okay, when I was treating the skull, it started shaking a lot because the spine was compressed, so I was stimulating a little bit the spine. Just by rotating a little bit the head, you have an influence on the spine. It starts shaking a lot. I treated the spine, and then this shake stopped when I was like that. But there was a car accident. Probably I could have treated the car accident before the skull, but it doesn't matter. The important is that these things are done on the same treatment. I will see him again. We will take a feedback regarding if he feels any different when he plays sport on his lower back, obviously, because that's what was the complaint. And for the moment, thanks for watching.